Well, hello. My name is Dr. Gerald Goldstein. I'm the medical director and founder of Fertility Specialists of Texas. I wanted to go through some slides and just talk to you a little bit about the process that we use when we start trying to understand why you are having difficulty to conceive. Hopefully, you'll find this helpful. Obviously, we'll be speaking at our appointment, and certainly it's a lot of material, so hopefully having it recorded will allow you to listen to it a couple of times, and then certainly when we meet, we can go over specific questions that you may have. I think it's important not to underestimate the effect of fertility in terms of on one's lifestyle and how much stress that it can cause. It's actually a lot now as people are waiting longer until they try to get pregnant. It's actually becoming much more common. And I think that if you mention to your friends, which I know in the past people have been kind of hesitant to do in the past, but you'd almost be amazed at how common fertility has actually become. I also think it's important not to underestimate the emotional aspects of infertility. That it's just very, very frustrating when you spend most of your life trying not to get pregnant, and then when you want to get pregnant, you can't. It's really not fair, and I think it's important not to underestimate the effect that that can have in terms of your life and in your relationships. So I just want to say that up front. When you look at the causes of infertility, there's really a variety of different reasons of why you could have difficulty getting pregnant. And we want to go through systematically and look at all of these reasons and make sure we have an understanding of why you cannot get pregnant. Again, a number of different reasons, and we, in the course of our evaluation, are really looking to discover if there's a specific factor that's making it more difficult for you to conceive. I wanted to go through and review a little bit. I'm sure a lot of this is review for y'all, but when you look at pregnancy, for pregnancy to occur, there's really four things that need to be in place. One is that you have to release an egg every month from your ovary. The eggs are picked up from the fallopian tube. Sperms deposit in the vaginal cavity. It swims up in the uterus, fertilizes the egg in the fallopian tube, and then the embryo floats down, and 9 months later, you have a baby. So typically 1 month you ovulate from one ovary, and the other month you ovulate from the other ovary. It basically goes back and forth. And during the course of our evaluation, we want to look at all of these factors to make sure that we understand what is going on. So after your initial consultation, then we will have you come into the office where we'll want to do a brief physical exam. We want to do an ultrasound. An ultrasound is a transvaginal ultrasound that allows us to get really detailed pictures of the ovaries, to look at what we call the antral follicle count, to look at the uterus, to look at the fallopian tubes through a hysterosalpingogram and a semen analysis. And these are the main components of the fertility evaluation. After we do an ultrasound, then we're going to want to get lab tests. And the lab test is really looking at hormone levels. And the hormones that you're going to hear a lot about are things like AMH, which stand for anti-Müllerian hormone, as well as FSH and estradiol. The FSH and estradiol are hormones that are obtained at the first part of the cycle. So when you have your period, typically they're obtained between days 3 and 5 of your cycle, and they give us an idea of egg quality. AMH gives us an idea, for example, of how many eggs you have in your ovary and how many we could expect when you're undergoing treatment. We also get things like your thyroid level, rubella, genetic testing, so we can test for hundreds and hundreds of different diseases. And we typically would get this on your first appointment. We usually takes about a couple of weeks to get the genetic testing back. We can test for hundreds and hundreds of different diseases, and we would then only need to test your your partner, if in fact you became positive, if you were positive for one of these diseases, which is an autosomal recessive disease. When we do the ultrasound, we will be looking at the uterus, the lining of the uterus. We'll be looking at the ovary size. We'll be looking at the follicle count, and looking for any abnormalities such as polyps or uterine fibroids. The pelvic ultrasound allows us to look at the ovary, where you can look at these little black holes, which are follicles. And so we'll look at the follicle count both on the left and right ovary, and we can correlate that with the lab test. So the blood work really checks the ultrasound checks the lab work. There are special studies that we may do if we want to get a closer look, for example, of inside the uterine cavity. So if we want to look inside the uterus, then we can put fluid in. This is called a sonohistogram that we do in the first 10 days of the month. And that allows us to look inside the uterine cavity. Normally the uterus is kind of the walls of the uterus are collapsed on itself, but you can see right here, when you put fluid in, you're able to see inside the uterus to look for polyps or fibroids. And again, when you do the ultrasound, you're able to look at these little fluid-filled sacs, which are basically have eggs. You're not able to see the egg, but you're able to see the fluid around the egg. And you produce an egg every month, right? So one of these little follicles grows, becomes much larger than this, and that's what you eventually release. The hysterosalpingogram is a X-ray study that we do in the first 10 days of the month. And it allows us to know if your tubes are open and if the uterus is normal. If obviously you would want to know, and we would want to know if one of your tubes were closed or both of them were closed. And so by doing the HSG, we're able to put dye inside the uterus, and hopefully we can see it come out through both of your tubes. And that's done at one of our offices here in Dallas, where we're able to do that evaluation. Last thing is really the semen analysis. Semen analysis basically involves us looking at sperm, and we look at the concentration of the sperm. We look at the motility, or how fast the sperm's swimming, and the shape of the sperm and the morphology of the sperm. We recommend 3 days of abstinence before we do that. And again, we're able to get really detailed information regarding the sperm count, which is really important in terms of making treatment recommendations. After you have completed these testing, then you would typically have a telehealth, and we'd be able to talk to you about your evaluation, see if you have any questions, and really come up with a plan. And the plan really depends on what we find in our evaluation. So it's really a very, exciting time in terms of really being able to drill down to truly understand why it is you're not able to get pregnant and really come up with a plan. And we'll talk about a variety of different options, depending on really how aggressive you want to be, and then ultimately come up with a plan, which you should be able to start the following month, really. So again, we'll spend the first month just getting information. I always like to say we're like building a story. We have some of the story, but we don't have the whole story. So we want to really get the whole story, and then we can talk about different options and start treatment to eventually have you be well on your way of really having a child. Again, I hope you have found this useful. I look forward to following up with you in terms of any specific questions you may have during the course of the evaluation. And I look forward to helping you build your family. Thank you.